Thank you for watching HPSM's Provider Onboarding Series video on diversity, equity, and inclusion. This is the final video in our Provider Onboarding Series. In this video, we'll cover HPSM's membership diversity, health disparities, resources for closing health equity gaps, and much more. As of 2024, HPSM's network includes 173,439 members. 92% of our members are enrolled through Medi-Cal. Our members come from everywhere in the world. Almost half of our population identifies as Hispanic or Latino. The largest populations are Hispanic, Latino, Other, and Asian or Pacific Islander. The largest subgroups in our de-aggregated data on the Asian and Pacific Islander group are Filipino and Chinese. When we look at disparities by race ethnicity, the Black identifying subgroup experiences disparities in kidney exams for diabetes and well child visits. Additionally, the Asian or Pacific Islander subgroup experiences disparities in blood pressure control and diabetes. Finally, the Caucasian subgroup experiences the highest volume of disparities, including in blood pressure control, diabetes management, cervical cancer screening, well visits, and child and adolescent immunizations. Nationally, communities of color are more at risk for negative health outcomes and discrimination due to past and present social injustices. At HPSM, our mission is to address these inequities by ensuring high-quality care for all San Mateo County residents, regardless of insurance type. By becoming an HPSM network provider, we know that you share this commitment. To support you in achieving this shared goal, we've developed tools to help you provide culturally and linguistically appropriate services. At the individual level, cultural awareness will ensure that HPSM members, your patients, feel heard, understood, and supported in their healthcare experience. At the community level, culturally informed care can help reduce racial and ethnic disparities in healthcare. Federal regulations prohibit discrimination on the basis of many factors, including age, race, color, national origin, disability, religion, sex, and more. Understanding institutional and structural racism is crucial for healthcare providers and health systems because these issues directly affect the quality of care we deliver to our communities. Policies and behavior, whether intentional or unintentional, that discriminate against people of color can lead to significant disparities in socioeconomic status, education, health outcomes, and employment opportunities. Racism often operates subtly within organizations, manifesting in ways that may not be immediately visible. By recognizing the daily inequities faced by our members, we can better understand the barriers to their health and wellness, as well as our own implicit bias that affect care. The best way to address institutional and structural racism in your practice is to take a patient-centered approach and treat every member like an individual. A patient-centered approach to communication happens when a provider can consider who the member is and where they are coming from to help develop a shared understanding. Shy away from making assumptions about your patients based on their racial, ethnic backgrounds. Avoid trying to relate to patients based on identities they hold, as this often perpetuates microaggressions and discrimination at large. Ask them questions to get to know more about them as individuals, then create a treatment plan together. There are further ways patients can be discriminated against when they visit their provider. Language is one of them. When we look at language, 45.1% members prefer a language other than English. Our threshold include Spanish, Chinese, including Mandarin and Cantonese, and Tagalog. Members speaking non-threshold languages like Korean, Portuguese, and Russian experience disparities in cervical cancer screening, well visits, perinatal care, and childhood immunizations. We want to discuss health literacy. Health literacy is a degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. Even when language is not a barrier, medical terminology, emotional responses, and stress can all interfere with people's ability to understand health information and treatment options for themselves and their loved ones. This can affect their ability to make informed healthcare decisions and may ultimately lead to worsened and preventable negative health outcomes. Even when you've established trust with a patient, they may not feel confident in saying that they don't understand a diagnosis or treatment plan. Because of this, the responsibility of health literacy lies with the provider, not the patient. You can make healthcare information more accessible by utilizing interpreter services for members with LEP. Using techniques like the teach-back method when talking with patients or their care providers, ensuring that appointments are accessible for all patients at all points of contact, and providing tools to support patients in getting the care they need. More health literacy resources for providers and HPSM members are available on the HPSM website. Please make sure to continue building upon health literacy and humility practices as it's an ongoing, unending learning experience. Next, we want to look at disparities by age. When we look at disparities by age, the 17 to 21 age group experiences disparities in diabetes care, well visits, and perinatal health care. The 22 to 50 subgroup experiences similar disparities in diabetes care, controlling blood pressure, and well visits. People with disabilities experience a high volume of disparities, including in asthma medication ratios, blood pressure control, diabetes care, and cervical cancer screening. When we look at disparities by gender, the male subgroup experiences disparities in diabetes care and well visits. HPSM currently does not collect sexual orientation, gender identity and expression, or SOGI data. The LGBTQIA+ community in the United States has historically faced prejudice and discrimination because of ignorance. It is our job to make sure members not only receive culturally inclusive care from their providers, but from HPSM staff as well. It is essential to define key terms that will help us understand how to better serve our members. Here are some tips and definitions our providers have found helpful when working with LGBTQIA+ members. Please pause the video and carefully review these definitions. One way HPSM measures how we and our network are doing is by reviewing patterns in member grievances. Grievances are submitted by our members throughout the year and analyzed by our population health management team. To learn more, please visit www.hpsm.org or email psinquiries@hpsm.org. That concludes our provider onboarding series. As always, thank you so much for watching.